The U.S. Ambassador to Uganda, William Popp, has justified the merits of capacity building of critical staff in the health sector. He was officiating at the graduation ceremony of the 9th cohort of Public Health Fellowship Program and the first ever Laboratory Leadership Fellowship Program.
And this is work that is saving lives. We have over 1.4 million Ugandans that are benefiting from health, HIV prevention through the PEPFAR program, for this example. So this field epidemiology program today is one part of a broader response in being disease detectives around the country and around the region.
As of 2022, the African region is home to nearly 1.5 billion people and has only around 2,000 field epidemiologists.
This status, coupled with an alarming deficit of workforce in the health sector, threatens the health of the populace in majority vulnerable countries.
Let me also remind our graduates that you are entering the field during the time of unparalleled global challenges, from emerging infectious diseases like mpox, Ebola, and Marburg, to far-reaching impacts of climate change on health, antimicrobial resistance, and the rising burden of non-communicable diseases.
We've already had that there's a big gap not only for the country but also Africa at large. But we urge you, those that have graduated today, that first serve your country, please, because the gap is already there. I know opportunities are there. Adverts are always out. Affiliate has already said, Africa CDC is already advertising, but we request home first, please.
The Dean Makerere University School of Public Health, Professor Rhoda Wanyenze, wants the fellowship program web spread wider to capture the increasing demand for health economics.
The health economics capacity in this country is still grossly limited, and I think probably that's an area we need to look at, even as we improve the monitoring and evaluation, especially also integrating impact evaluation.
The postgraduate training program that targets specialists is funded by the U.S. government through the Center for Disease Control and Prevention and development partners. This means the sustainability of the program is entirely dependent on the whims of donors. And it's right here that Dr. Alex Ario, the director, Uganda National Institute of Public Health, sees a problem.
In the event where CDC says we don't have money now, which is happening right now, because they're saying we are now cutting funding. So when they cut funding, government has to come in. And you know the process of getting government money. It's not a short process. It's a long one. So unless you have an institutionalized structure, which is recognized, legally recognized by government, you can't get funding from government. So that is what we are trying to push to ensure that we sustain the program.
Since inception 10 years ago, the Field Epidemiology Fellowship Program has passed out a total of 106 specialists, while only 6 applicants secured placement in the first ever Laboratory Leadership Fellowship Program. Dorcas Kimono, UBC News.